Our strategy sets out 5 outcomes that we believe will, if we really focus on population mental health, then we should see some key improvements for people. And those 5 priorities are that we will focus on keeping people well, that we'll build their resilience and self-management, that mental health and physical health services will be better integrated, that mental health services will be transformed to become recovery and outcome focused, and that we think about quality and making sure that people have access to high quality services that are informed by need, not just by that good idea, let's move forward and get on with something, and that we constantly challenge that stigma and discrimination that is there every day when you're working in mental health services, or indeed if you're a user or carer of someone with mental health services. So as part of the IQ process, one of the first things that the team were able to support us with was answering that question: are we all in this together? There was substantive engagement with I would say over 100 service users, providers, carers, commissioners developing our programme. One of the tools that was introduced right at the beginning of the programme was actually to sit down together as a group and think about, okay, if this is our ambition, in 5 years' time, what might some local newspaper headlines look like? Person seen by right service at right time, shock. Leeds, remembering when mental health was treated separately to other services. And I think the best one of the lot, the prize winner, was that Pharrell William moves to Leeds because we're so happy. But in that humour, it gave everyone that chance to sit down together, really consider the framework and get everyone focusing together to move this work forward. We had 4 workshops with the IQ team. They ran very quickly, and we had at least 40 people attend all of those sessions. It wasn't the same 40 people all of the time. We're never going to achieve that. And I think that is a great strength that we've found, is that we've had a core group of people who've been able to attend all of the workshops, but a number of people have had to dip in and out because of other commitments. And somehow the process has still held everyone together. And one of the pieces of feedback that we've had is that people who maybe came to workshop 1, missed workshop 2, joined us again at workshop 3, were very able to pick up the threads again and make that contribution. So I don't know what it is about this programme, but it does seem to be able to hold that space and hold that purpose to take everyone forward. So the first day was really about creating that firm foundation again. We've written the strategy, the framework, what does it mean, and how we're going to take this forward. Our second day was about building on that work and starting to develop our driver diagrams. And I don't know if all of you have been involved in driver diagram work, but I think that was really the tool and that took us through the process, sort of that consistent going back and refining, adjusting and coming to a position about the work we wanted to take forward. In workshop 3 we went back to the driver diagrams, so we did some refining of that work and actually checking out that if our primary drivers were the work that we really wanted to take forward. And then finally at the final workshop we brought everything together and really set the scene for moving forward post IQ support. Through this work we have really managed to hone down to 4 key themes for our programme to take it forward, which makes things much more realistic, manageable, achievable, all of the things that we would want to see. We have thought about new rules for service design, and again one of the exercises that we did was really just opening everything up to talk about how services look now. And again at that point the contribution of the service users and carers was immense. So we've done that and have a lovely long list of new rules for service design. But the feedback that we've had from the service users is that they just felt that they were amongst equals, that they were valued and that their voices were heard straight away. And actually a lot of the support structures that we'd put in place weren't needed. There is something about this way of working that helps us cross some of those boundaries. We've created champions for the programme. There's been great enthusiasm and people have stepped forward to take some of the leadership roles. And crucially, during, I think it was session 3, we realised that pooled budgets for this programme would be desirable, and our 2 lead commissioners actually left the room, wrote a short paper and have started a process of engagement with senior leaders in the city now, and we're gaining some momentum to move to a pooled budget, and also moving towards a joint commissioning unit approach to this work as well. We've developed an innovative governance process for the programme, which I'll talk about in a minute, and we're doing some joint work with other commissioning teams where we've not had that engagement in the past, and the 2 key teams are our urgent care colleagues and our lead children and families commissioner for the city. Out of that, we've strengthened that relationship, and we're going to be taking some children and families work forward now as well. I think this statement from Sabina, who was one of the service users, is fabulous. It was like a big jamming session where everybody's ideas were brought together and everybody's ideas were listened to. And I think that's it in a nutshell, really. I think that's a really good definition of what was happening in the space. Things that didn't go so well, and we haven't got to an agreed model yet. But actually Chris Evans, I think on the radio this morning, was saying, you know, something about, well, it's a model and it's good enough, get going, don't let it stop you. Some of the challenge about the quick turnaround of the information as well, I think that was one of the things that held people together. But as a person who was doing the write-up and coordinating and thinking about the next session, then it is quite a labour-intensive process. So the tools and techniques. The introductory exercise, one of the sessions we didn't do an introductory sort of warm-up exercise, and it was sorely missed, wasn't it? Everyone said, oh, we didn't do a warm-up last time. So, and that created a sense of fun, and obviously released that sort of creativity early in the day to get everyone working together. Driver diagrams, constant driver diagrams, and we will keep using them, and they are in a corner of the room, and we will keep taking them back to the project groups, and we'll refine and refine and refine and start new ones and keep going. What was most useful? The detailed planning between the sessions, lots and lots of telemeetings and discussions and emails, and I think it has been this accelerated development, really, and I know that other people have already mentioned it. Not only are we in a different place, but we've probably got to that place much quicker than using those other sort of more traditional routes. You can see that these are our 5 outcomes by which we will steer, check in and measure whether we believe we're delivering on the programme. And these are to focus on information, mental health in the community, a focus on children and families, and crisis and urgent care. What we did then do was challenge ourselves to think about how we're going to manage all of this together and keep that outcome focus as a centre of our work and all of our conversations. And so we've looked at a distributed leadership approach where we're aiming to develop 5 triumvirates across here, 5 triangles of leadership, where we have a senior system leader, a champion, and probably a service provider. There's some way to go on this development. At the moment I'm working on a paper looking at that leadership and thinking about the individual roles. People that we've identified so far: a local councillor who's a mental health champion. We're looking at Health Watch, we've got service users engaged, public health, adult social care, all the people you would expect to see, but some quite different groups of people as well who may be taking this forward, but there's more to do.